Transition Radio TV, brought to you by thebreastformstore.com. They have everything you could possibly need for your cross-dressing and transgender needs. Visit their website at www.thebreastformstore.com and tell them Transition Radio sent you.
The following ingredients include a look behind the scenes. Cook uncovered until hot. Add grooves to taste.
I would like, if I may, to take you on a strange journey.
Once upon a time, there was a little girl.
The accident was over a year ago. A second woman has been elected president. A 12th planet has been named in the solar system. The last wild polar bear has died. I slept through it all. I was here for my waking. He called it a beginning. He said it was good. I think he may have thought that anything I did was good.
Welcome to Transition Radio, live from Milton Manors, Florida. With your host, Mark Angelo Cummings.
And your hostess, Jessica Cummings.
Well, good evening and welcome to Transition Radio. Welcome to our humble abode. We are getting ready to take off on our journey tomorrow, and we're doing the show on our RV. Tonight we have a very special guest, Dr. Vartan Mardirossian, who grew up in Bulgaria. He quotes, "I am of an Armenian origin." He did his residency in head and neck surgery first in Italy and moved to Boston, Massachusetts, where he did his residency in head and neck surgery again.
Dr. Mardirossian did a fellowship in facial plastic and reconstructive surgery with Dr. Spiegel, who is one of the fathers of facial feminization surgery, also known as FFS, completed this past July. I have been extensively trained in FFS for the past 6 years, working in close contact with my mentor.
Now I'm established in Jupiter, Florida, where my plastic surgery practice is. Our expertise in cool and body work with a particular emphasis on facial feminization surgery. We perform surgeries in our office in a fully licensed operating room or in the local hospital with highly trained and reliable staff. And now welcome to our show, Dr. Mardirossian.
Hey, Doc.
Thank you. Thank you.
Thank you so much for being on our show. We had you on the radio show, and we enjoyed the interview so much, and we wanted to bring you back. Plus, you are one of our sponsors, and we're very happy to have you as our sponsor. You do great work, and we highly recommend you. Thanks. So, any surgeries today?
Oh, well, today we didn't have anything. We operated on Monday. We did a minimally invasive facelift and neck lift, which was a great procedure. Patient did really well. Had minimal bruising and minimal swelling, and when I took down the dressing the day after, she hardly could believe of how little she's swelled up, and she looks great. So that's the biggest satisfaction for us, having patients who look and feel great.
And that's what it's all about. It's an art, and knowing that you had 6 years working with a highly extensive doctor, it makes you an excellent doctor yourself. How was that experience for you working with your mentor?
Well, it was an enlightening experience. I should say. I first got introduced to him 7 years ago, and started assisting in the operating room from the get-go of my residency. And the techniques that he taught me, and the processing of and facial analysis of how to transform a male face into a female face, and with particular attention to the features of the face that are key in perceiving a face as female, were really of the greatest value for me, and that is what helps me nowadays pursue my goals. Facial feminization surgery basically subdivided in two, I should say, branches, or two thought processes. One thought process is how to transform a male face into a female face, and the other thought process is how to transform an aging face in a more youthful face. So when you are analyzing the patient's features and facial features, you have to actually think about both things together. And that was, the thought process that my mentor taught me. The rest is surgery, but the surgery is not as important as what goes on in your head when you meet with your patient.
And what created the interest in you working with the transgender population?
Well, that goes a little bit, and we have discussed that. That goes a little bit back to who I am. As you know, I'm Armenian, of Armenian origin. And I grew up in Bulgaria, and then I continued my life and education in Italy. And throughout my journey, there have been multiple personalities, many people that would tell me, well, now you live in Bulgaria, now you live in Italy, you should feel more Bulgarian or more Italian. Whereas, I was just feeling Armenian because that's where I am. And I just realized that it takes strength to be whoever you want to be, and not being stuck with some label that somebody wants you to bear. And then years later, when I encountered the first patients that my mentor was operating on with sex reaffirmation surgery, I actually prefer calling it that way as opposed to transgender surgery. Those patients reminded me of my sensation, my feelings back in the day when I was insisting on what I felt being, and not something that people wanted me to be labeled of.
So you could relate with the transgender population because
in that sense, yeah, absolutely.
We feel we are something, and people want to point out that we're something else. That's good.
Exactly,
it's important.
Exactly. That's the comparison, and that's and that made me realize the amount of courage and determination that one should have in order to pursue on their path.
Definitely. Let me ask you, what are your feelings regarding trans individuals, and how do you explain to someone what it is exactly that you do?
Well, as I was mentioning, transgender individuals are some of the most knowledgeable and courageous patients that I've had, because of the reasons that I listed just now. It takes really a lot of courage to change the road of your life, to put your life in new tracks. So I really believe that this takes a lot of courage, and I feel that we are helping them. That's what we're proud ourselves of doing, and And this is one of the instances that I do believe plastic surgery and facial plastic surgery in particular are necessary. Usually we talk about plastic surgery as an elective thing. I think in this case, it actually is necessary for the well-being of the individual.
Definitely.
Yeah, exactly. Now let me ask you, is this something that medical insurance would cover? Or is this something that would be totally cosmetic that it will not cover? Or do you know of any that may cover a circumstance like this?
In most instances, it's a cash-based procedure. Some insurances start covering it. In particular, some employers, self-paying employers, like the bigger companies in the United States, would cover the entire thing or parts of the facial feminization surgery. But in general, it's considered cosmetic.
Yes, okay.
Can you explain to our listener what exactly is involved in facial feminization?
The things that are involved are strictly correlated to the perception of the face, now of the human face. Now we know that when we look at a person's face, we know within several seconds if we are looking at a man or at a woman. And there are many studies, and some of the most important studies were actually accomplished by my mentor, Dr. Spiegel. He showed that the first area of the face that a person looks at is the forehead, and then the next object to observation is the mandible and the jawline. So the forehead and the jawline are those elements that are most decisive in sexual perception. Therefore, one of the most frequently performed procedures in transgender or sex reaffirmation surgery is the scalp advancement, where the hairline gets advanced, and from recessed hairline we obtain a nice oval-shaped hairline, which is more feminine looking. Then in second place, we recontour the forehead and we remove the protruding ridge that is situated above the eyes, and that has the purpose of helping the light flow in the eyes, and which is a very feminine, a very attractive characteristic, a very attractive feature of a female face. Even if you take a picture of a man versus a woman, you will see that the woman puts in emphasis on the appearance of her eyes, whereas the man puts their face in a way that the shadow is cast over their eyes. So in order to make a face more feminine, you want to help the light flow into the eyes. And that's why we remove the prominent bony ridge of the forehead to make it more smoother. Another procedure that I was mentioning is the mandible contouring. As you know, men have a square jaw, okay, and women have a nice smooth oval-shaped jaw, and we can do that with small incisions going through the mouth. We can accentuate also the cheeks with fillers or with submalar or cheek implants. Sometimes reduction rhinoplasty is performed, where the size of the nose is reduced. Another interesting procedure is the lip lift, which helps the patient afterwards show their, shortens the lip and makes it more attractive, and reveals the upper teeth, which is a very attractive feature. So we have a series of procedures along with the trach shave. We have many procedures that we can perform, and obviously we don't perform all of them always, but we have to dose this treatment according to what the patient's needs are.
Right. Sounds like you can spot a trans girl a mile away.
We have a short clip
Well,
that we want to show.
it's not always that easy.
We want to share a short clip on how the procedure is done and some final results.
I dreamed a dream in time gone by. When hope smiled, life was giving.
اشتمك بقى تجي no.
I dreamed that love would never die. I dreamed that God would be forgiving. I was young and unafraid. When dreams are made and used and wasted, there was no ransom to be paid, no sun and song, no wine untasted. But the tigers come with their voices soft as thunder. As they tear your hopes apart, as they turn your dreams to shame.
It's amazing the difference.
Yeah.
How,
Those are good results, I should say. Yeah.
yes,
Definitely. Definitely. I think that should be one of the first things that trans girls look at getting done versus the lower side, because this is what everybody sees first. Nobody sees what's in between your legs unless you want them to. So.
I totally agree with you. Yeah.
Definitely.
So let me ask you, what is the recovery time and what is a patient to expect from this procedure?
It depends on what procedure we're talking about. For example, tracheal shave has a recovery time of overnight in the hospital where the patient is observed to make sure that there are no problems with breathing and voice. And traditionally, we've never had any problem with that. And then, there's some soreness, some swelling that goes away within a week. Forehead contouring and scalp advancement, usually we combine those procedures, take 2 to 3 weeks to have the majority of the swelling resolve, and within a month the patient sees the definite results of surgery. Cheek implants, obviously facelift, neck lift, blepharoplasty, those all have the normal recovery times that those procedures are known for. We're talking usually 3 to 4 weeks, the most in terms of swelling resolution. The longest recovery time, in my experience, is the mandible contouring, which again is performed through incisions through the mouth, so nothing is really seen on the outside. However, that procedure would take you probably two months to have a complete resolution of the swelling. Sometimes even up to 6 months. It basically, a week after the procedure, looks like you had a bad toothache and an extraction. But all the rest of procedures, you can say that within a month and a half, you would have resolution of most of the swelling.
Awesome. Now, the other question that I have is there any particular order that, you recommend personally that this be done in, as far as, from the different procedures that are involved with FFS?
Yes, there is an order, and that's determined by what are the features that you as a surgeon determine are going to give the patient a more feminine look from the get-go. It also depends on what the patient desires. A lot of patients don't want to make a notable transition in the very beginning and start off with a procedure like the trach shave, or they just want to appear more youthful, so they may come to you for a blepharoplasty or for a facelift and neck lift. And only then they would pursue with a forehead contouring. Other patients want to have the transition happen altogether. They've already changed the name and they have made a determination that they want to transition completely, so they go for the entire, the entire set of procedures. Some just want to have a scalp advancement and forehead contouring. So that gives them a subtle change, but not a complete transition. So as you can see, it's various and depends on what you consider to give the feminine touch to the patient's face, and depends on what they want and what their priorities are.
Exactly. So you can do this all subtly too, for people that
Absolutely.
are just like
yeah, absolutely. Some people take it one step at a time. They just start with a trach shave, and then maybe a year after they want to have a reduction rhinoplasty and a lip lift, and then maybe a year after they want to have a scalp advancement and a forehead contouring. So you obviously have to respect the patient's will and goals.
Absolutely.
Italy is definitely a beautiful country. How is the trans population accepted there?
Italy is, as everything in Italy, I've lived there for 15 years. I guess that's what you're asking me this question. It's an interesting question. It's an interesting country because Italians are always leaders in innovation and very inventive people. So as a part of that, they already in 1991 they accepted legislation defending the rights of transgender individuals. However, it's also a country where the discussion always goes on, and there's always disagreement, and the politicians make sometimes rapid turns and tend to change their mind. That being said, my observations, and I left Italy 8 years ago, but my general observation is that situations of economic downturn usually do not favor tolerance. And sadly, I think this is true, and I'm not sure of the precise reasons why this happens, but when you have hardship, economic downturn, people just focus on other priorities, and tolerance decreases. That's my observation. And this is kind of a general opinion. That being said, Italians are great people, and I know that there is a very active transgender, gay, and lesbian community there, and they periodically organize various events.
Exactly.
We're going to take a quick break to announce our sponsor. That would be you. So we'll be right back.
Thank you.
Dr. Vartan Mardirossian is a facial feminization surgeon in Jupiter, Florida. He did a fellowship in facial plastic and reconstructive surgery with one of the fathers of facial feminization surgery. He has also completed an extensive training in FFS for the past 6 years, working in close contact with his mentor. Dr. Mardirossian performs surgeries in his office in a fully licensed operating room or in the local hospital with highly trained and reliable staff. Give him a call today at 561-624-0900. That's 561-624-0900. Dr. Mardirossian is highly qualified and understand our needs. And we're back
with Dr. Mardirossian.
She has a hard time. See, I'm Cuban, so Mardirossian, right? Is that Mardirossian?
He's very good at it, but I'm just...
You sing it. It's like singing Mardirossian.
Well,
you're Cuban, so you have the Soviet cars the way we had them back in the day.
Yes, yes.
Trust me, nobody wants to hear me sing.
How is your staff? Are they trained to deal with transgender individuals? Are they pretty empathetic and understanding? Because I know that a lot of individuals have gone to a surgeon's office and they feel not so comfortable because of the way the staff treats them. I'm pretty sure that they've been well trained.
Absolutely, I have wonderful stuff here. That actually is the best feature of my practice. My practice is a pretty beautiful place, but the most beautiful element I have here is my staff. I have a great receptionist who understands the needs of the transgender population. I have a great patient and office coordinator. A great feature that we have here is an on-site operating room that not many surgeons have. Therefore, we have a nursing team that is dedicated. We have an excellent anesthesiologist dedicated to our procedures. A lot of the procedures actually are done in twilight sleep without general anesthesia, and that brings a faster recovery and better outcomes and less operating room time. Because, as you know, general anesthesia takes time to kick in and takes time for the patient to wake up. Now, a lot of the procedures are performed in twilight sleep very successfully. And we have been one of the leaders in minimally invasive procedures, so I apply that to my facial feminization surgery. But going back to my staff, the main advantage here is that the patients see always the same faces. They know who the nurses are. We show them the operating room from the get-go, so they know the environment. It's a very friendly environment and very cozy. However, in the same time, we have all the equipment and of course all the training to deal with possible situations and complications. Everybody in my staff is highly trained and very experienced, and they're nice people. I work with Jupiter Medical Center, where I have my surgeon privileges. Definitely, some procedures definitely need to be performed in a hospital setting, but I'll tell you that Jupiter Medical Center has been one of the hospitals where I was surprised how friendly everybody is. It's just it's something unique, very very different from the hospitals we used to. So I think this is a great working environment. It'll be a great experience for my patients. So
even the hospital that you have your doctor privileges in, what you just spoke of, the Jupiter Medical Center,
yes,
they're very knowledgeable about the transgender population and everything like that as well, right?
Absolutely. Excellent. And it's a great hospital to be at. And I've discussed obviously with the administration the needs of my patients, the entire setup, how things work. All rooms are single rooms, so there's no privacy is guaranteed. They even created a concierge floor for patients that would like that. We also have affiliation with a great facility, which is actually called the Secret Garden. And it's a mid-level facility, which means that it's not a hospital. However, you get qualified nursing care there. And that's a great place for recovery too. And again, it's called Secret Garden, so the privacy of the patients is 100% guaranteed while they get great care.
Do you ever do any work on female-to-male transsexuals who want to masculinize their face?
I personally don't do that. I'm sure that there are surgeons around that they do. I personally specialized in male to female.
Excellent. And do you also do genetic women, like any procedures like the facelift or?
That's great. That's a great question. Yeah, of course. On genetic women, we perform. We are fully licensed, fully certified plastic surgery practice. We perform facial as well as body procedures here, including body contouring, breast augmentation, breast lift, abdominoplasties, along with traditional facial plastics procedures like facelifts, neck lifts, blepharoplasties or eyelid surgery, various laser treatments, various chemical peels, fillers, Botox. Now, there's an interesting concept here, because some women actually come to us to treat a high forehead or coarse features, that we help those women look more feminine. There are studies out there which show that feminine is actually a synonym of attractive, where even more feminine men are more attractive than more masculine men. Obviously, those are studies and theories, but the reality is that many women actually need forehead contouring, many women need scalp advancement, many women need mandible contouring, and we have done that in Boston, and we will continue doing that here. That is actually a new look and a new philosophy of how to look at facial plastic surgery. It's not only, as I mentioned, it's not only aged too young. It's also ambition in a process to become more attractive, and that is that I would say is a new science within facial plastic surgery. Unfortunately, not a lot of surgeons understand that concept. A lot of surgeons think of the order of, you need a facelift, I'll give you a facelift. You need a rhinoplasty, I'll give you a rhinoplasty. Not a lot of people think of the face in its harmony and its balance. And that's exactly what we strive to perform in our center.
Excellent. Yeah, because it's definitely an art form. You got to have some sort of artistic view to be able to make it happen.
Absolutely, absolutely. And a lot of knowledge of anatomy.
Well, yes, I hope so.
I can show you all the books there.
The two people you don't ever want to hear the words "uh-oh" from is your plastic surgeon and a tattoo artist.
Uh-oh is not good.
So let me ask you, what should your transgender patients expect from the procedure, and how can they assist with their recovery?
First of all, they're followed by an endocrinologist. A lot of them are followed by endocrinologists, so they know to stop their hormones 2 weeks in advance. That is done in order to prevent thromboembolic events, or better, like to prevent formation of clots in the blood vessels while the patient is still immobilized and not very active. Hormone replacement therapy is usually restarted a week out of the procedure, from the procedure. What they can do is obviously follow our instructions. We try to not give unnecessary complicated instructions. We try to give them the essentials, of how to take care of their incisions, of how to take care of their skin. Again, the incisions are performed in a way, and that is a special characteristic of having a facial plastic surgeon work on your face. All the incisions that we perform are planned and performed in a way so they are hidden. As for example, the incisions that we perform for a mandible contouring are hidden inside the mouth. The incisions that are performed for the scalp advancement, brow lift, and forehead contouring are hidden in the hairline. We perform them in a special way so that the hair grows through the incisions. That is very important. The incisions for example, are hiding inside the ear and in the sideburn and behind the ear, so people wouldn't see them when they look closely at you. And most of our patients actually wear their hair backwards, and that's not a problem because the incisions are seamless when they heal. So that takes compliance with our post-operative instructions, using the right amount and type of local topical medication. It's standard medications are prescribed after the procedure, like pain medication and antibiotics. And that's pretty much it. For mandible contouring, we recommend soft diet for a week. Some of the stitches come out in 7 days, and some of them are self-absorbing. So.
Right. And it takes a very special person to do what you do, let me tell you, because just watching that little clip of that rhinoplasty just made my stomach queasy. How do you do it?
You have to keep in mind the motivation why you're doing it. You're not doing it for the sake of doing it. You're doing it for the sake of achieving a result. That's what should always guide you in doing our profession. There's many things that could be impressive, but you have to always bear in mind why are you doing this? What is the purpose of you being there? How can you do it in a way so that you don't spend unnecessary time in the operating room? Okay, there's no place for wasting time in the operating room, particularly if you're performing a facial feminization surgery that will take you, if you go at a good and sustained pace, 7 to 8 hours. Okay, so you have to really manage your time, be very efficient, so you can accomplish the most in the least time possible to have the patient under anesthesia for the least time possible.
I believe it's also important for the outcome to be good that the patient eats healthy, doesn't smoke, and things like that, because you could do a beautiful job, but if they're not actually doing their part, that beautiful surgery could turn out to be a disaster. Am I correct in saying that?
Totally, you're absolutely correct. Smoking is something that should be interrupted at least 3 weeks before the procedure and should never be restarted, obviously. But if the patient cannot make it, we recommend that they restart smoking as far as possible from the procedure. Just because smoking compromises the ability of the organism to form new vessels, new blood vessels, to help with the healing process. That's very important to say.
And also the facial area, which is a lot harder to heal. So as they're smoking, it's just going to really create a lot of complication. And also diet. Am I correct? If you
absolutely, yeah. Actually, in our center, we give patients a special. It's called soft tissue packet. It has special. There are some medications that they take prior to proceed to the procedure that improve the ability of the tissues to heal, and that has been shown by multiple publications in the literature. Not a lot of mainstream plastic surgeons use those methods, but we have seen that with the use of this cocktail of medications, we have great recovery times. The face heals. Going back to your question, the face heals can heal well if you treat it right. All these procedures, they need to be performed by knowledgeable surgeons that are board certified. That's why all the diplomas in the back wall. And with handling the tissues has to be performed in a very careful fashion. After a while you've been doing this, it becomes something automatic, but it's a cocktail of habits and ways to behave in the operating room that end up with a nice and good result.
I know you have a new blog called HTTP Ask DRM Info. Would you like to talk to us a little bit about the blog? And I know it's where patients could ask questions directly.
Well, first of all, I didn't know if to call it Ask Dr Mardirossian.info or Dr M Info. I'm kidding. I guess nobody would go to that website if it was Ask Dr Mardirossian. They wouldn't be capable of typing it in. It's a website that I created with the intention of answering questions about these procedures, not only facial feminization, but any facial plastics procedures. just because I've noticed that there are many blogs out there are many forums. People ask each other about the prices. People ask each other about the recovery time. I'm sure you know about the multiple forums that are there. Some of them open, some of them closed. I've seen very few doctors that are willing to answer questions online. Um, and be helpful to their patients. And most of these patients are on the internet and they are looking for answers. And I definitely think that a facial feminization surgeon like myself could be of great help to these persons.
Yes, definitely. And doctors definitely need to have a good bedside manner, and you seem like you have a really good manner in general, so.
That's
Thank
very
you.
important. Very important.
So, let me ask you, where can our viewers get a hold of you, and what message of encouragement do you have for those wanting to look in the mirror and see what they feel in their heart?
I want to start with a quote which I recently put on my Facebook page actually. It's really hard to grow, it's really hard to change, but it's really, it could be painful, but it's even more painful to be somewhere, stuck somewhere that you don't belong to. In other words, I know that it's a difficult trip, a difficult journey. Um, we're here to help you. Um, we are here to help you make the right choices to go through this transition and to help you with the recovery, so you're not alone in your path. We will do everything that we can to help you achieve the appearance and harmony that you desire, because the goal of our surgery is to achieve a good harmony between the body and the spirit of the patient. Um, Now, where we're located? We're located in Jupiter, Florida, an easy drive from 95, exit 79, if I'm not wrong. And our new website, which is palmbeachplastics.com, will have a good description of how to get to us. Our 561-624-0900. You can get hold of me in the blog. I have a dedicated Facebook page, which is basically, if you go by my first and last name, you'll find me easily. And again, our website, palmbeachplastics.com, is most of our inquiries could be directed. Now we are in the process of renewing our website, and that's going to be ready in approximately 1 to 2 weeks. And that is going to give a full description of our procedures, how are they performed, and I'm planning to put on some videos that are explaining, along with this video, that they're explaining the nature of the procedures and what to expect.
And the viewers could also go to our website. You have your page there, and we have you on the front page where they click and it takes them directly to your Facebook page. So
thank you.
We want to thank you so much, Doctor, and
Yes.
sorry for the inconvenience of the time today. Thank you for your patience. Thank you for all you do.
No problem. When we were taking, when we were taking call in the hospital, this is when you start warming up. So no problem. You never excuse yourself, never apologize for the late time with me. It's not an issue.
Anything
You're
else?
great, Doctor.
Anything else you wanted to add or say before we end the interview?
It's we're passionate about what we're doing. That's all I can say, and that what makes me personally a happy person, a happy man. I like what I'm doing. I'm passionate about it. I like for my patients to like them, and that is the biggest achievement, the biggest satisfaction I can have. And in order to achieve that, I will apply all my knowledge and all my skills.
Excellent. And you got a gorgeous office, by the way.
Yes.
Oh,
Beautiful office.
I wish. I hope that along your trip, you can come and take a look. It's really remarkable. It's a great, friendly atmosphere. You don't feel in a doctor's office. It feels like a nice living room where you can share your thoughts and talk to a person that will understand your needs.
Excellent.
Definitely. Well, thank you so much, Doctor. We honor you.
Thank
and
you, Dr. M.
Thank you for
No problem.
doing all that you do.
Thank you. Thank you.
Thank you. Thank
Have
you.
a good night.
Have a good night.
We'll talk to you soon.
Yeah, and enjoy the trip.
Thank you.
Yes, we'll try to stop by on the way north. You gonna be in
Sure,
tomorrow?
absolutely. If you're driving, I'm not sure. Are you driving by?
No,
Possibly.
we have to head directly.
But we got. It's gonna be like 6 hours driving, so it's gonna.
Okay, so
But
it's you gotta manage your time. However, in the future, we could be in touch.
Definitely.
And you guys can come over. Yeah, anytime.
definitely.
Well, thank you once again.
Thank you so much.
Take care.
Bye bye.
Good night.
Good night.
Good night.
We'll be right back with our Shame on You segment.
And the transition video of the week. Stay tuned.
Hi there, Gay Life Television viewers. This is Joe Crynock from Straight Not Straight and Cup of Joe here on Gay Life Television. So I have to ask you a question. Do you have a Roku box? Well, if you don't, then you're missing out on a ton of on-demand and exclusive content that we have available on Gay Life Television Premium. You can subscribe today by going to the Roku store on your Roku box or on the web at Roku.com and adding Gay Life Television Premium to your Roku for only $1.99 a month. Bringing quality television to the LGBTQ community, it's Gay Life Television Premium.
That brings a lot of memories, that song.
I gotta say, I love the intro.
I know, definitely. First of all, I want to thank all our great bloggers. I mean, they're amazing writers. They just investigate a story and put it together, and it's just an amazing crew. And a lot of people are probably thinking it's negative to use the word shame on you, but there's a lot of things that needs to be brought to light in the community. And without awareness, there can't be change. We definitely have had, over 6,000?
We'll just leave it at that.
Yeah, over 6,000 hits in less than 2 weeks. Actually, 2 weeks today that we've had the blog, and it's amazing. Some people say negative things. Other people are saying a lot of positive, because it's almost like they're saying it's about time.
And we got trolls.
And we got lots of trolls, yes. A troll in particular that we will be talking about in the upcoming weeks.
She might sue us.
Yes, she might sue us. Yes, no, she won't. But anyway, tonight we have an article by Zirota Slingen. And the reasoning behind this article is that she's pointing out that there's a lot of individuals in the trans community who want to take the role of leaders. She wrote, "I've always rejected the idea of being a leader. I've been told I'd be a good one, whether it would be through the role of a mother or a project manager. I just can't call myself a leader in anything I do or say, or the product of a manufacturer. When I bring ideas to the table, I want them to be put under scrutiny, like a filter.
And I want other people's ideas equally treated as mine, and not at the suspension of others. Together we can bring a difference. We can build something beautiful. Yes, leadership is not that difficult, and not that difficult to understand. Just like teamwork. It's truly that simple. But not when it comes to people who have an appeal to majority or authority. In reality, the human world still fights for equal rights and still has to make way, though thick-skulled individuals who have a position of relative power that they abuse for self-improvement. You can probably recognize this effect already, or even remember the experience. Politicians, managers, coaches, you name it.
People who have a position of relative power also have the ability to determine someone's fate, with all permanent consequences attached to a decision. Some decisions can even scar a person for life. It still happens in a lot of countries in the world, where victims of a sexual assault receive a punishment instead of a criminal who committed the assault. No one likes the idea of being bossed around. No one should want to be treated like that, unless you fancy that fetish and fantasy in your hobby times. To each his or her own taste, I suppose. No one with a clouded vision should be put into a position of relative power. Everyone should know by now that with great power comes great responsibility. It's a saying that sadly is taken for granted and still not practiced while it's preached.
I can't stress it enough. The fact remains that chosen leaders in this world are founded by their voters, and that does not mean it is always the right choice or vote. Just because a majority agrees with what one leader says doesn't mean it's going to bring the results they are hoping for. I recently received a comment on one of my YouTube videos entitled Open Letter to Janet Mock, No Transsexual Role Model. This comment struck me as somewhat threatening, I must say. But to no surprise, just like the Justin Bieber and Lady Gaga fan club, I expect nothing less from such blinded fools. It's already quite evident that when one from a trans community speaks out an honest opinion about a transgender celebrity, one can get the heat from the fanboys and fangirls.
And I was badgered for speaking my mind about that. And it's no surprise that a lot of these folks suffer from what's known as an appeal to majority fallacy, argumentum and populum. It's what's wrong with this world. Check out the remainder of the article at Shame on You blog with great investigative reporters and authors. If you have something that needs to be heard that affects our community or outside of a community, please go to the blog and fill out the form. We look forward to hearing from you.
Yes, and that's Shame on You 2014.blogspot.com.
Yes, definitely. We're looking forward to hearing from you guys.
Yes.
The light has been out for many years of doubt. But now that I've started to see what lives inside of me, I can feel free to create the new side you see.
For I can no longer hold back the need to be that I have always been. And now for the transition video of the week with Kane Barr.
Go and live your life. I'ma live tonight. I don't care what's right. I'll live your life. I just wanna be me.
Well, remember to send us your transformation video at transitionradioshow@gmail.com. We look forward to placing them on the show. We want to thank Dr. Mardirossian for being on the show and for being our sponsor. We also want to thank the Breast Forum Store. We want to thank Joe, and we want to thank Gay Life TV.
Yes.
We want you guys to follow us on transgenderhighway.blogspot.com, and we'll be posting and putting videos and creating little documentaries and stuff. And yeah, we're excited and can't wait to hit the road.
Should be interesting. We're going to show the good.
Yes, definitely.
I might even catch Mark in the bathroom.
No. I'll make sure to have the camera with me so you can't be.
Oh, no. Just wait.
Yes.
You've gone too far.
Definitely.
Is that TMI?
Yeah.
You've crossed the line.
Yeah, right. Well, we want to tell you, everybody, thank you so much for viewing and being faithful. What do you call it? Fans or viewers? Viewers. And
viewers.
Stuff. We are going to end the show with a little transphobia humor so that people lighten up a little bit. If we can't laugh at ourselves, then we deserve to be laughed at. That's the way we look at it.
Absolutely.
We love you, but remember to always love yourselves too. Good night. Mwah.
I've got it all figured out. The baby can have Bart's crib, and Bart can sleep with us until he's 21.
Won't that warp him?
My cousin Frank did it.
You don't have a cousin Frank.
He became Francine back in '76. Then he joined that cult. I think his name is Mother Shabooboo now.
Oh, it's hopeless. There's some she-males in Gazebo 3, a nasty-looking spider in Gazebo 6, and the less said about Gazebo 8, the better.
Ah, Chief, thank God you're here. We reserved Gazebo 7, and look.
Jeez, how many gazebos do you she-males need? Let's start with mega secret number 1. You gotta squeeze every penny. You see this tux? I got it cheap because Roy Cohn died in it. That fancy yacht? A bargain, because it smells like cat pee. And those beautiful women? They used to be men.
After Chernobyl, my penis is falling off.
And penis is Russian for...
I won't drink it both. Homer's old garage is all I need. I won't drink it both. Because Mo's a big jerk and a she-male too.
Patty, it's not what you think. Veronica is a man.
Look at the size of that Adam's apple.
Veronica, how could you?
Patty, I love you. But long before we met, I disguised myself as a woman and lied my way onto the LPGA tour.
Yeah, love conquers all, huh? I remember when she was Helen Schwartzbaum. In fact, I remember when she was Harold Schwartzbaum.
You what?
Oh, honey, no one's gonna believe that wig is real.
What do you mean, wig?
And about that voice.
What's wrong with her voice?
Steve, is that you?
I'm gonna knock you inside out.
Doctor already did.